Will I wake up tomorrow? Is my pacemaker working fine? Will my heart stop beating during my sleep? These are few of the questions that a heart patient goes through on a daily basis. Sometimes a heart patient also thinks it would have been better if I had died 3 years ago when I had my first heart attack, rather than go through this pain of physical pain and the psychological pain on a daily basis, where the day starts with thinking, I need to take that statin, I need to take that blood thinner to survive. I cannot have salt, I cannot have ghee because that is restricted. And all those life decisions are constricted around one heartbeat. Every second, every moment of the day, is my heart working fine? Can I run after that bus? Can I play with my grandkids? And what is the root cause that is being given by the medical industry? It is due to cholesterol, it is due to fatty deposits, and it is due to hereditary. I find it very hard to believe that if my great grandfather had the wrong kind of fish, and in this birth I am going to suffer an heart disease because of that event, I don't agree so. And there are researches done by the Western medical associations as well, which are being dumbed down the gutter because they have identified what the root cause is. And in today's video, I'm going to help you decode what mistakes are being done by the medical industry in the treatment of a heart patient, why statins and blood thinners are not going to cut it out, and how we can reverse that condition by living a yogic lifestyle. Hi, I am Biswajit. I am a health coach. I have been unraveling all these myths that is surrounded around treatment of cardiological diseases and why we should be focusing on getting electrons. So what happens when we have a blocked artery? So for example, this is our artery, and it has an inner blood vessel that is known as endothelium. The endothelium should ideally be negatively charged, and the blood itself has something known as zeta potential, which is also negatively charged. So both the walls of the blood vessel and the blood flowing through it are negatively charged. When that happens, the blood flows through smoothly. So it's like two magnets with the same poles facing towards each other. It will start moving, right? We have all played that game when we were a child. So that is the functionality which happens between your blood vessel and the blood. It will keep repelling, and the blood then flows in a smooth fashion. But what happens is, due to the pesticides and the food that we eat right now, there are a lot of heavy metals which get clogged in that artery. So whenever the heavy metals like lead and mercury, they're positively charged. So once they get stuck over here, let's say this red portion now becomes your positively charged. This is going to attract the blood, and they're going to come and get stuck over here. Now that, my friend, is the root cause. Now what happens next is very incredible, because the body treats every positively charged site as an injury. So it is going to send its immune systems to this particular area to figure out what is happening, and they'll try to block this off. And what comes to your help is cholesterol. Cholesterol comes and it forms a mesh around it, and in some cases it will calcify it. In case there are pathogens which come and also start feeding on it, the body's immune system will create a calcification. So they'll try to block it off using cholesterol. So cholesterol is not the root cause. It is trying to help you. But over the time, this becomes a block and then we have to do a bypass surgery. But what was the root cause? The root cause was the positively charged blood vessel, and most importantly, those heavy metals. And all the treatments that are happening is around treating the symptoms. The cholesterol is just a symptom. Cholesterol is very important for the body. So when we are taking statins to lower the cholesterol, it is not helping you. It also has its own myriad of side effects. The longer you use statins, it is also going to damage your liver. So this portion that we talked about, right? This block will create an inflammation around this area. Now, in order to track this inflammation, we are taking some statins, and it is going to impact our liver. So on the long run, not only your heart, but your liver also starts getting damaged. And for some patients, it is also prescribed blood thinner. And how a yogi would treat this, right? I've never heard a yogi or even gods or deities having a heart disease. Shiva does not run around with a pacemaker. And a yogi who stays in the Himalayas has never died of an heart attack. Even at the age of 200, their heart is beating fine. It is because they are getting more electrons. They are negatively charged. We need a voltage of minus 25 millivolts minimum to sustain that negative voltage around our blood vessels. And what are the sources that a yogi goes to get that electrons? Sun, grounding, and also ghee. Now, ghee has been demonized by the medical industry, especially for those who are heart patients, because cholesterol. Now, ghee has a lot of benefits. It has a lot of electrons to give you only if you acknowledge and eat it. Ghee in Sanatan Dharma holds such a special place. Every yajna, every homa, we offer ghee to Agni Dev. Now, if ghee was that bad, Agni Dev would have died of a heart attack a long time back. We would be probably living in Stone Age if Agni Dev was not blessing this current society right now. So let's acknowledge this fact. Ghee is not the main problem. The main problem is we are not getting enough sun. We are not getting enough grounding, which are our main sources of getting negatively charged electrons into our body, fixing the root cause. And sun is one of the best sources by which we can eliminate those heavy metals, lead, arsenic, mercury. If they get lodged in your heart, it will lead to diseases, and medical treatment will only surround around cholesterol. Let's reduce the cholesterol, statins, blood thinners. And this also leads to a big identity crisis. And the decisions that one makes when they're constantly worried about their heart is a fear-based decision. The confidence goes down. They become more dependent on others. The decisions are taken from a place of fear, not a place of abundance like they used to. So let's be conscious. Let's track the root cause. Let's attack the root cause and fix it. And the solution is get more sun, get more grounding, have ghee. If you have stopped, start including in your diet. And I understand everyone would have their own obstacle. So this Navaratri, I am giving out this offer to everyone who needs it. Please feel free to schedule a one-on-one consultation call with me. I'll put in the details in the description of this video, and we will figure out, assess what your obstacle is in your environment, in your lifestyle, and how we can get back our negative electrons, get ourselves charged. Let's be negative about it. That is important. Our body cannot be positive. Our mind has to be positive, yes, but our body has to be negative. Let's get that negative electrons flowing, and let's move away from that fear-based decision to an abundance-based decision. And this is my offer to anyone, not only for the heart diseases, but any other disease that you may have, any pain, inflammation, discomfort in your body. feel free to schedule a one-on-one consultation call with me. I'll be more than happy to help you out. And please subscribe to this channel if you find value in it. Please share with someone who you think would benefit from this information. And I'll see you in my next video.